Hello everybody, thank you for being here with me. My name is Diana Bonger and I'm an orthodontist working in Romania. I'm practicing exclusively orthodontics, but I am part of a bigger team with different specialists. With some of them I'm working in the same building, but with others I'm working at long distance. So I know that following guidelines and the good communication are essential when working on interdisciplinary cases. Today, we are talking about the interdisciplinary treatment strategy, how orthodontics can be integrated in this kind of treatment planning, about the ground rules that help us navigate through it, and the limits that interdisciplinarity can have. Everything that I'm going to show you today is the result of team approach, of me collaborating with Dr. Ionuț Brânzan, who is my prosthodontist, with Dr. Bogdan Bâldea, who is my surgeon, and of course with the dental technician, because there is always a dental technician involved when prosto is involved. The problem with complex cases is that sometimes they can be overwhelming, especially when there are many specialists involved, because we have to answer some questions. Who sets the treatment goals? Who sets the treatment sequence? Who is coordinating the team and the patient? How do I know as an orthodontist what's possible and what's not possible from the point of view of different dental specialties? Ever since I was an orthodontics resident, I was fascinated with adult cases. I was fascinated watching and reading the late Dr. Vincent Kokic, treating his adult patients and seeing how his team is working. Some years later, I was fortunate enough to meet Dr. Ionuț Brânzan and Dr. Bogdan Bâldea, and they inspired me with their deep thinking and their precise work. So we started talking about cases, we started working together on our cases, we started teaching each other and pushing each other to go further. We are the living proof that collective intelligence is higher than our individual ones. And of course, by working in a team, we have less problems to solve by ourselves, and the results we can reach are more aesthetic, stable, and functional. And guess who wins the most? It's our patients, because every time when there is a multidisciplinary approach, those single approaches are less invasive than they would have been by a single approach. Doesn't matter if we are an orthodontist or prosthodontist or periodontist. Every one of us are thinking about being minimal invasive in their treatment approach, and we are all thinking about the prognosis of our treatments. How can our results be more stable in time, more aesthetic and more functional? That's why when we are planning a complex cases, we should be always thinking about the resources we can use in order to reach our goals. And by resources, today I am referring to the colleagues of different specialties. I always involve my colleagues in planning my complex cases just in the same way as they involve me in planning their complex cases. But we should remember that interdisciplinary treatment planning means that the specialty, may it be orthodontics, prosthodontics, or periodontics, should bring an aesthetic, functional, or biological advantage in order to be included in that treatment planning. And as a strategy, it always depends on the concept, knowledge, skills, and technology the doctors and the dental technicians are using, and of course on the pathology expectation and understanding of our patient. And because in healthcare we always have some limits, this time those limits are related to the knowledge and communication between the professional team involved. They are related to the time and costs our patients are willing to spend, and of course on their compliance. Moving further, I laid out 6 ground rules that, if followed, they can help us to better work in a team. They are speaking the same language, acknowledging patients' expectation, establishing realistic objectives and being able to visualize them, establishing and following treatment sequence, controlling the inflammation, and understanding and following prosthetic treatment plan.